This morning, we're going to talk about hormone therapy, the natural versus the synthetic debate. It's still heated when it comes to women fighting menopause, and it was recently the topic of a full Oprah show. So here to talk about it, pros and cons, more information about it, Dr. Elizabeth Salata and Dr. Jill Cotell, both doctors specializing in internal medicine. Thanks so much for being here. Kind of opposing views on this, but really let's explain. We're talking about bioidentical hormones. What is that?
Bioidentical hormones technically is a term to refer to any compound that is identical to something that your body makes anyway. But the way we've been hearing it used a lot and the way women are talking about it is referring to these creams and tablets that can be made up with different hormones in them and kind of adjusted to tailor to fit what exactly the woman needs to treat her symptoms.
And why is it warranting enough attention that Oprah dedicates an entire show to this topic?
My opinion is I think people have the impression that it's safer than traditional hormone therapy. And the problem with that concept is that the FDA really hasn't regulated these hormone preparations. So our job as physicians, we feel, is to come and just help the public understand, because we're getting a lot of phone calls from the Oprah show. We're seeing a lot of patients who want more information. And so our job is to help to clarify this debate about the fact that, you know, are these hormones really safer? And, you know, we know they work, but that's really...
But so these celebrities are coming out recently and swearing by it. And so why are celebrities stepping up and doing this?
They feel great. They make you feel wonderful. I mean,
no more hot flashes and that sort of thing?
Well, it's not necessarily true. These products have been around for a long time, decades. And there's nothing new about them. It's just that they've been brought to attention more recently. But I've been prescribing them for about 10 years, and I've been working with a compounding pharmacist who's been doing it for 20. So they've been around a long time. It's just... I think ever since there was a large study not too many years ago showing that the traditional hormones that women have been taking for decades had a lot of problems in terms of different types of risks. And so women have been looking for other options besides taking their traditional hormones.
All right, so let's talk about the pros and cons then, because we spelled a little bit out of the increased risk with hormone replacement.
Right. Well, hormone replacement in general, whether it's bioidentical or any other type of hormone replacement, has an increased risk of breast cancer. We know that from the Women's Health Initiative. Ovarian cancer patients that have had ovarian cancer really shouldn't be taking any kind of hormone preparations. People we now know from also the Women's Health Initiative with heart attack history, stroke history, blood clot history, we did find from the Women's Health Initiative with traditional hormone replacement being Premarin, Prempro, those types of products, did have higher risks of these problems. And so that's when the whole bioidentical movement started to come into play, because the bioidenticals have been around a long time, but because there's not a lot of data about risks related to them, people feel like it's a safer alternative. But hormone replacement in general has to be done with very conscientious hands. You need to go to a provider who's well-versed in them. You can't just go to a compounding pharmacy. I had a patient come in to me within the past few weeks who'd had breast cancer. She says, oh, but I still want to go get my hormones from the compounding pharmacy. And I just rolled my eyes and went, what?
You rolled your eyes on the inside.
Actually, I had to be very firm with her because she felt so bad from the treatment related to breast cancer, from menopause, all this happening all at once, that she was desperate. And I went, honey, I know you're desperate, but this isn't an option for you at all.
Well, let's talk about the alternatives then quickly, because we had a list of those as well. Alternatives to hormone replacement, what are some good ones?
The idea is that if possible, you would like to be able to get your body to be able to produce the hormones naturally. And there's several ways you can do that using acupuncture and herbs. But short of that, there's a lot of lifestyle changes that should be made, that can be made. And then if you go through those alternatives, I think you'll talk about, then I think go into hormone replacement. After that, I think is a reasonable consideration, but not with the traditional type of hormones that we've been using.
So the bottom line, obviously you have a little bit of a different opinion here, is for people to really know, to really find out about it.
Get educated.
And what did our parents do when they had nothing? They just had to deal with the hot flashes and the menopause.
And us as families had to deal with our parents.
Exactly.
And
I remember my mother.
That. Right. And some people went through unfazed. You know, we're living longer now. We want to have a better quality of life as we age. So that's all part of it. So you just have to be, I think our message to the public is that you have to be extremely careful. Don't have a false sense of security. Speak with a practice. Our practice specializes in these things. We know what to do. You know, we invite people to call. We have a website that they can visit.
All right, yeah, it's a lot in a short amount of time, but we'll have the information linked up to our website with this segment, and people can find out more about it.
Hey,
thanks for coming in.
Thank you very much.
All right, thanks. Go to san diego6.com for more information.